Next, from the state capitol, we speak with Maryjane Wurth, president of the Illinois Hospital Association, about Governor Quinn's proposal to cut $2.7 billion from Medicaid, largely by lowering the reimbursement rates for healthcare providers and hospitals. This runs about 8 minutes.
Maryjane Wurth, president of the Illinois Hospital Association, thanks for joining us. And this is, as I understand, kind of the day when a lot of hospitals and healthcare providers are coming to the state capitol to speak with lawmakers about the governor's proposed cuts to the Medicaid system. What message do you have lawmakers when you're stopping in to talk with them?
Yeah, thanks, Terry, and it's a pleasure to be here with you today. You're absolutely right. We have hospitals, nearly 100 individuals and hospitals from around the state coming to the state capitol today to tell their story about how massive the impact will be on patients, communities, and hospitals if we go forward with the budget proposals and an 8% rate cut as outlined by the governor's proposal. So we're asking that every single legislator, before they take action and vote for blunt rate cuts, that they pause and really understand what this means for patients, for access to care, for jobs in the communities. And we even have some hospitals around the state that fear that they will even be able to stay open if that level of cuts are ultimately passed.
And that's where I was going to go. There's obviously, as we have, I think there's some 200 hospitals across the state. Some obviously are not going to be doing with a whole lot of Medicaid patients relative to their budget. Others are going to be dealing with a higher level. On those hospitals, and I would imagine that they're going to be both in urban areas and maybe in some rural areas, have you heard from their CEOs, and how many might be actually threatened with closing if that would be the reality? Should these cuts go through?
Yeah, we have about actually a third of the hospitals across the state. You're correct, there's about 200 hospitals, and a third of them are already operating in the red. And it's just not the inner city hospitals. It's not just those that are in the most rural areas. It's across the state, in some of our cities, in some of our other communities. And they certainly are very concerned about what this impact is going to mean. We have another 12% that are really just on the edge, that are then flipping over to the side of operating in the red. And when you combine that with concerns about property tax exemption and cuts at the federal level through Medicare, there are those that are, again, already operating at a loss that really wonder whether they will be able to have the financial stability to continue to provide access to health care going forward. So, everyone's doing these calculations, and the uncertainty that's out there as far as how do we really forecast, how do we keep our hospitals open, is a very real discussion going on in the hospitals across the state.
And let's go to the governor's side for a moment. Obviously, he would probably say, if he were here, I don't want to make these cuts. They're being forced on us. I have the state to run, and we have to cut our costs. What would you say to the governor who's facing a very tough budget?
Yeah, and we are very sympathetic to the challenges that the state have, and we've been trying to work with the administration, with the Department of Health and Family Services, and certainly with the General Assembly. In fact, when the governor first came out with a proposal to, eliminate $2.7 billion out of the Medicaid program, or 18%, I mean, that's a huge amount, without detail, the hospital community took it upon themselves to come up with a list of alternatives that we felt actually would help the state close that gap, but also preserve access. So we offered a variety of proposals that equaled $1.4 billion as our effort to work with the state, because we do appreciate it. But they're looking at efficiencies, it's looking at making sure that those that are on the Medicaid rolls are in fact legitimately on the rolls. Let's verify that. Let's maximize federal funding opportunities. We think there's a lot of opportunity there. And let's continue to work towards quality improvements, care coordination, that we don't need to make this a simple math exercise, which unfortunately is what it's turning out to be. And and we can have a thoughtful, multi-year plan that gets us on the right path with Medicaid and makes it a sustainable program. Terry, I'm not sure if you're aware of this, but Illinois is already the 44th lowest in the country as far as Medicaid spending per beneficiary. You can't get much lower than that. We're below the national average and well below other states with major population bases like Illinois.
And we're right outside the Senate chamber, so those bells of the Senate will be coming into session here in a minute. We won't go much longer, but I want to illustrate for the viewers, sometimes people have no idea of the dollars involved. But I talked to one hospital some years ago, Children's Memorial Hospital in the Chicago region. And they had incurred losses in the area of $50 million from Medicaid patients coming over from Indiana. So right there, people who were not residents were not eligible, and so the hospital wasn't compensated. When you extend that across, it's not going to be $50 million for every hospital, but obviously to give some dollars to how much it can run into, it's an enormous cost for one hospital to bear and to make up. What are you hearing, and to some extent you touched on this, but what are you hearing when you hear from these CEOs? I don't know how anyone, frankly, operates a hospital these days with all the uncertainty, not only in Medicaid, but you have the president's health care that may or may not go into effect.
Tremendous change going on.
And then as far as bringing jobs into the state, I don't know that any businesses are going to be attracted to Illinois if they move into an area where there's not an operating hospital. That's a lot on the table, and I'm trying just to synthesize it. So when you go in and you only have a couple of minutes to talk to some of these lawmakers and you really want to get the point out right away, what's your elevator speech, as you would say?
Well, and I have many different ones, but I want to hit on the economic benefit that you're referring to. Hospitals employ 250,000 individuals directly in this state. In many, many counties, they're one of the top 3 employers, if not the top. The healthcare sector is still one of the 2 sectors in this state that's growing. We certainly don't want to be about losing jobs in this state. Hospitals are part of the future of this state. We can still drive it. These jobs are very important. They're job creators, and we certainly don't want to be stepping backwards. But we do have real alternatives that can help the state move forward, and we think that's the rational discussion that needs to be. 8% rate cut, $350 million approximately to the hospitals is not the right path when we're already at 44th in the country.
And I've heard that some of your hospitals are only sustaining themselves now through borrowing just to make ends meet.
Well, you know, every chief financial officer, every CEO that I talk to is going through a very thoughtful calculation, looking at all their services, looking at the benefits they provide the community, looking at their jobs, and running a variety of scenarios of what-ifs that they may have to truly implement depending on what the outcome is. There's a lot at stake, not only for the Medicaid system in the hospitals, but for the communities as well, because when services are eliminated for Medicaid, they're eliminated for the entire community. There's a better way, more thoughtful, rational way to solve the issue of how do we have a sustainable Medicaid program going forward, and we want to work with the state on that.
Maryjane Wurth, thank you for joining us. Maybe we can visit again at some point in the future.
Pleasure talking to you, Terry. Thank you.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.